Good evening, everyone. Once again, welcome to Vaccine Confidence Dialogues online. My name is Rudy Page. Today, we're with a community organisation in North London, the ACLC, and great to see you all. And Hugh, how are you?
I'm very well, thank you, Rudy. Good to be here and good to see everyone joining the team tonight. I look forward to a very productive and effective meeting on the vaccine and stuff like that. So nice to see you.
Thank you very much. Val.
Yes, hi, Rudy. Thank you for inviting me here and for hosting this very important meeting. I'm Valerie Graham. I am the chairwoman for the African Caribbean Leadership Council Women's Group, and otherwise known as the West India Cultural Centre based in Haringey. And we're looking for a really good debate this evening around, the vaccine confidence. And so thank you, Rudy, for inviting me. And, as I said, the women's group in Haringey is all about empowerment of and inspiring and training women to optimize their potential and their greatness. So it's really important that this discussion that we're focused on this evening takes place. And the word confidence is important because that's part of what we do as a women's group about building self-esteem and confidence in the Black community, especially for women.
Great.
Thank you.
Great, thanks for that, Val. And it is about being informed, reassured, and in order that the community can make the choice. And that really brings me to Dr. John Ndikum. John, how are you, sir?
I'm well, thank you, Rudy. Thank you for having me again.
Great to see you. Great to see you. Right, we're going to start the dialogues really with Dr. John, and we're going to focus on some of the key questions that the community's really been asking about. And that's the first one being about safety. And so if you can cover the key questions that have been asked by the community, Dr. John, as it relates to safety of the vaccine. Is the vaccine safe? And how can they be reassured? How can the community be reassured?
Rudy, thank you very much. Very good question. As for the question, is the vaccine safe? That's a binary question, black and white question. As we know, a lot of these things aren't black and white. There's a lot of data emerging that actually, there are incidences of side effects with various vaccines. So when you have this, people can become very afraid. I think it's important that people take this in context and realize that, for example, in the UK, nearly 25 million people have had the AstraZeneca vaccine, for example. And while there have been several reported cases of clots in some of those people, and that is being investigated and taken seriously, when you look at the numbers, it's say 0.0004% incidence of these clots, or that percentage of people have had that, which is a lower percentage. It can be argued that it's a lower percentage, and the data bears it out as well, than number of clots in people who get COVID and possibly even in the general population. So to answer the question, is the vaccine safe? It depends what you're comparing it to. So is the vaccine safe compared to COVID? Absolutely. Is the vaccine safe compared to things that predispose you to certain illnesses, obesity, high blood pressure? Absolutely.
Okay, thanks for that. And then, of course, there's another key question, is that there's still people are still interested or still asking questions about in terms of they need more information about the vaccine. So I guess in that they're talking about what is it made of? Because of course, again, there are all these various stories about what goes into the vaccine.
Okay, absolutely. So having more, I'll answer that. That's a two-part question. So the first part of the question is people need more information about the vaccine. Absolutely. And I think it's important that people do seek out information, but it's even more important that people seek out information from the right sources and obviously turn to the right kind of the correctly trained professionals, the appropriately trained professionals, namely scientists and doctors. As for the constituent of the vaccine itself, the main thing is what the active agent, which is usually a little bit of the spike protein or a bit of genetic material which produces a spike protein. Everything else is made to allow survival of that key material, and within a few hours or a few days of being in the body, it's eventually degraded and broken down. So I know that people might be worried that people try and make correlations between vaccines and MMR and having mercury and so forth. Now that's been very roundly confirmed to not be true. I mean, all the data, all the scaremongering data and the conspiratorial data around that has been shown to be false. But people must know also to turn to the right sources for information.
Of course. One of the key challenges also is on understanding on how the virus is spread among families, at work and across local communities. And why that's probably of great issue now, because government stats that came out yesterday say that overall the population of the country have taken 90%, or there's 90% coverage of the groups, the particular groups, the priority groups coverage. But in terms of Black African and Black Caribbean, so with Black African, it's 58.8%. And Caribbean, it's 68.7%. So could you kind of talk us through a bit in terms of what it means in terms of transmission of the virus?
Well, I was actually reading an article from my published by my graduate school, Yale School of Public Health, and they have the first data of outcomes in nursing homes that have received the vaccine. So it's just to get an example of the kind of coverage. So nursing homes that have had the vaccine showed a 68% level of protection, which is actually consistent with the data in the general population. So morbidity or harm and mortality or death caused by the virus is actually dropping faster in nursing homes that have had coverage compared to the general population. So that should give you, I suppose, it's not exactly the answer to the question that you asked, but it leads on to perhaps what people are asking. Is it worthwhile getting the vaccine? Yeah. The data that's emerging is showing us that it actually is. So if we've got a community or communities that have reduced coverage, well, they're not going to have the same level of protection, and the data will bear that out as well, because those populations will be studied, and what we'll see is a disproportionate level of mortality in those populations. Now, we just need to go back to March to see that was indeed the case. And by disproportionate, I mean that, one person not having the vaccine doesn't mean one person will die. It's disproportionate in the sense that one person not having the vaccine might mean 3 or 4 people at risk. So we know it's spreading in an airborne fashion. We know that the vaccine is protective, and we know that communities that don't have the same degree of protection will suffer in a disproportionate fashion.
And really then that brings us, I guess, to long COVID, given the impact last year on the communities. Could you talk about long COVID and explain exactly what it is and the potential consequences in the long run?
Yeah, absolutely. You use the word consequence, and that's what long COVID is. It's a consequence, a long-term consequence in some people who've had COVID. COVID affects many systems in the human body, many systems and many organs, and sometimes the impact of it is longer lasting than would be expected of, say, the common cold. We've heard cases of young children who were formerly fit and well, been unable to walk. We've all had colleagues, most people have heard of colleagues who were formerly fit and well, who now struggle to walk up the hill, can't walk their dogs, are absolutely exhausted. We don't know the factors or variables that lead to people having long COVID, which means that actually everyone must be careful, because you can't assume that just because you're young, fit and healthy means that you can just brush the virus off. That may not necessarily be the case. So it's, in terms of what the impacts are, as well as affecting your health, it could affect your ability to function, to carry out your day-to-day job. And obviously they can affect employment, which can have, if things take the worst, to take a turn for the worst, could lead to just a downward spiral.
Yeah, and having looked at some of the symptoms and some of the, they can be, it's quite startling: extreme tiredness, shortness of breath, chest pain or tightness, problems with memory and concentration, difficulty sleeping, heart palpitations, dizziness, pins and needles, joint pain, depression and anxiety. And yeah, so it's quite a challenging.
Yeah, of concern of the, you know, absolutely it affects many systems of the body, but of concern for our communities in particular are the cognitive impacts, so the psychological effects of it, so difficulty concentrating, difficulty, you know, having clarity of mind, which obviously will affect your employment, and difficulty with mood. We know that our communities suffer disproportionately from low mood, from, you know, unemployment, from unfair treatment of work, and also from mental health problems. So this is going to be just another sledgehammer to communities or communities that already have many problems to contend with.
One of the other areas where there's been, one of the other priority areas, I should say, is the health and social care workers. So I wonder if you could say something around that in terms of why it's important for health and social care workers to take the vaccine.
Well, health and social care workers are in contact with patients and their carers. Okay, we know how easily transmissible this virus is. So although an individual may very well have a robust enough system or organs to not suffer adversely from the virus, that may not be true for people with whom they engage. Now, social workers are dealing with people who are particularly vulnerable. Their carers are particularly vulnerable, usually mentally, many times also physically. So I think it's just not just social workers, you know, healthcare workers, but I think not just social workers, sorry, but healthcare professionals in general, and people who work in professions and jobs that are people facing. It's important that we do what we can. So to actually answer the question, I can say that, okay, fine. So having the vaccine reduces the viral load inside your body, okay? Although you can still release the virus from your airways, the amount that can be released will be a little bit less. So it offers protection in that sense. But what we're actually aiming for with the vaccine is herd immunity. And for herd immunity to be achieved, you need to have about a 70 to 80% vaccination rate. So it's very important, if we want to provide population level health and prevention, that as many people as possible do have the vaccine.
So could you explain what asymptomatic, what that actually means? And
yeah, sure, absolutely. So when we were, doctors will talk about signs and symptoms. So signs are what a doctor's looking for. So for example, a rash is a sign, red skin is a sign, a broken finger is a sign. Symptoms are what the patient complains of. So chest pain, drowsiness, nausea, okay? Now, A just means the absence of. So asymptomatic means the absence of symptoms, the absence of complaints. So people who have COVID who are asymptomatic are those who have the virus, but have nothing to complain about. They don't have a cough, they don't have chest pain, they don't have fever, they don't have the fatigue that usually accompany the virus.
right, so
well, they may have a lot to complain about in their personal lives, but not as relates to the virus anyway.
yes, yeah, I can see the challenges. Again, I guess you can see some of the challenges around that. If people say that they feel well and they're okay.
It's really difficult, isn't it? It's really difficult because I don't blame people saying, well, I feel well, I don't have anything. And you can't know, you know, I've in the trials that I'm conducting, we do carry out COVID tests. I've had to call patients up and say, listen, your test come back positive for COVID, how are you feeling? And both of them actually, who I call, like, I felt completely well. But fortunately, they were both in jobs that required them to continue to maintain social distancing and maintain masks and wear masks, because those jobs were cognizant of the fact that actually you can still spread the virus even if you feel well. So I'm glad that those jobs have put those measures in place.
Yeah, and you mentioned about trials. There's been some concerns from the community as it relates to trials. So can you say a bit about that in terms of the involvement of African and Caribbean population groups as part of the trials?
Yeah, sure. The two concerns that I've heard raised are, the first one is there aren't enough Black people in the clinical trials for us to know that it works for our populations, which is valid. The second one is, well, this has been rolled out so fast that it's still in the trial phases. So to answer the first point, yes, there is definitely a paucity of Afro-Caribbean, of people of the African diaspora taking part in clinical trials. But we must remember that actually, as human beings, there are things that can be generalized. Now, some things can't, such as some diseases specific to certain groups, sickle cell disease, thalassemia, Tay-Sachs disease, to name a few. But some things can be generalized, such as how the immune system works, how hemoglobin works, how the kidneys work. The virus affects the immune system. We know that there is consistency in different groups and how the immune system works. So while there may not be a large proportion of Black people in these trials, we can say with a great degree of confidence that how it works in one group will likely be translated in other groups as well. As for the second concern, that the trial's been rolled out very fast and it's still in the trial phases, what we do know is that lots of people have spent years building the knowledge on which these studies are based. Okay, and that has formed the basis for rolling out the trial, having accelerated clinical trial phases. So preclinical is when all this data has been built up. And if anything, you can argue that it's been built up over the last 300 years. Okay, now, more specifically for this virus, immunology has really gone through an accelerated phase of progress over the last 10 years. And a lot of research from immunology can be extrapolated and applied to the code to understand how the virus works and how we can combat it. As for trials, so then the accelerated phase was phase 2 and phase 3. Phase 2 is when you're checking if the vaccine actually does what it says on the tin. Does it prevent people getting COVID? Or does it reduce the effect of COVID in people who do get it? If that is the case, then phase 3, you check safety and you check that it actually works, does what it says on the tin in a larger proportion of people. And I know that at this trial, they did it for tens of thousands of people. And then you roll it out. Now, every drug can be considered to be in phase 4 or in post-marketing surveillance. So we have a yellow book that doctors and pharmacists carry called the British National Formulary. And when an unusual side effect pops up, it could be for paracetamol, aspirin, we then have to report it to the appropriate governing body, who then incorporates it into the new BNF every 6 months. So yes, absolutely, people are right to say, well, yes, it's still being trialed. It is being trialed, but it's post-marketing surveillance trial. Every drug is absolutely being trialed and monitored. So that's what I want TP to get across to people, that we've established that it's safe, we've established that it does what it says on the tin, but we still are closely observing things. That doesn't mean that we've got a perfect drug out. It means that when things crop up, we're doing all that we can to make sure that people are as safe as possible.
Thanks for that. There's a couple of points you mentioned. One, sickle cell, which of course is still quite prevalent in our communities, African and Caribbean population groups. So with that sort of type of blood disorder, what might be the approach when it comes to vaccine? Can you talk about that?
Absolutely. Now, when it comes to something like sickle cell disease, as we both know, it will manifest in different ways in different people. Some people have the traits, some people have the disease. Some people who have the disease also don't have severe sickle cell crises, while some may end up in hospital every single week. So I wish I could offer blanket advice or blanket prescription for those kind of individuals. Unfortunately, I can't. What I would advise very strongly for these individuals to do is to speak to their clinician. Because for some individuals who may be in and out of hospital all the time, their immune system as a result has taken a huge hit. It may very well not be appropriate for them to have the vaccine, or the doctor may say, okay, we can have it, but we need to monitor you very closely. Whilst for others, who've got sickle cell, but are only in once every 2 years, then it may be a different story. So unfortunately, I can't give blanket advice, but I would say, do go to the doctor. If you're being seen by a specialist, by a hematologist, do speak with them, and they'll be able to give you much more tailored advice.
Right, and of course we do know there's at least 2 vaccines being given in this country, and of course there's 2 shots at least of the Astra one. Could you talk about that in a bit more detail?
Yeah, sure, absolutely. So there are actually several vaccines in the pipeline at the moment. A friend actually showed me a picture a few moments ago, which shows about 7 or 8.
Okay.
And there'll be other treatment forms other than just vaccines that will be rolled out as well, to give options to people that vaccines may not work for, as in their immune system may not mount the appropriate response. These different vaccines, I suppose, it's just they're different because there are different ways of creating immunity against the virus. So you mentioned 2 vaccines. The Pfizer vaccine involves the insertion of a piece of genetic material into the body that then, when it's inside the body, it ends up creating the spike protein. When the spike protein is created, the body then mounts an immune response. The body's military mounts an immune response, creates soldiers specific to the spike protein. So when the virus itself enters your body, the military recognizes it and attacks it. Now, the AstraZeneca vaccine, on the other hand, doesn't insert the genetic material. It's the spike itself is inserted into the body recognizes it, creates the military for it, and then attacks it when the virus enters the body. So it's just different ways of having the same response.
Okay, thanks for that. So I'm going to allow our visitors on the platform, are there any points of clarification that you would like, or any other questions that come to mind that you've heard from across the community you might want to put to Dr. John at this time? So it's open. Okay, Hugh.
One of the things that I've had an interest in is a clarification on the percentage. When the percentage is distributed, is it distributed as a percentage of the UK population when they say, for example, that only a minute amount of Black people are taking up the vaccine? Is the percentage based on the overall population of the UK, or is the percentage based on the small percentage of Black people in the UK's population, and therefore a percentage of that small percentage? I don't know if that makes sense.
Yeah, it makes sense. Absolutely, absolutely. Are we asking about a percentage of the entire population, or asking about the percentage of an entire community?
Yes.
So the answer is to do with the second one. So when they're saying there's a low uptake in certain communities, they're saying, okay, fine. For the white community alone, we've got 80-something% uptake. In the Black community, we've got 70% uptake. So that's what it is. So it's actually it's actually more accurate. Yes.
Okay. Thank you.
Because otherwise they wouldn't be able to compare apples for apples.
Okay.
Yeah. So just in case someone is watching this then on YouTube and not able to ask this question. So to be clear, it's not that they're saying that the percentage of Black people in comparison to the percentage of the UK overall population and not taking it up. They're speaking specifically about the small percentage of Black people in the UK, and it's a percentage of that small percentage.
Absolutely.
As a group.
Absolutely.
As a population group.
Yeah. Yeah.
Absolutely.
Yeah. That's a really good point actually here. Val? Need to unmute.
Yes, thank you for that, Doctor. A question that comes up, and I'm not sure if you've mentioned it, about sterilization in young women. So that's one of the concerns. And obviously when the vaccine is given, it has an interaction with one's melanin And have they tested it against, things such as this? So do you have anything on that?
Sorry, yeah. So first part of the question I understood about, addressing people's concerns around fertility. The second one I wasn't too clear about the melanin.
Yes, as you know, as Black people, we are darker skinned than the Caucasian white population.
Mm-hmm.
So there is some makeup around that, surely, in the DNA. And they talk around that somehow. There is nothing specific, but has any research or data come in about that? How does it interact with a higher melanin skinned person?
Or any kind of impact?
Sorry?
Any kind of impact?
Let me address the first question. Let me address the first question from a scientific perspective. So the function of melanin, obviously, the function of melanin is to reduce dangerous solar radiation and going past the skin and causing mutations. That's the only function of it. So the only difference between me and a white person is the fact that I have cells that protect me from the sun. Now, whether a vaccine that affects the immune system can affect the cells producing melanin, it could potentially do that. It can potentially, trigger some, affect some sort of cell proliferation. But whether that will do anything to any other systems, I don't see how that can be possible. So I would say something, people who are speculating that the fact that it may affect melanin differently may mean that it may have more severe outcomes in Black people or otherwise. I think that falls into the category of conspiracy. It's not based in science. It doesn't make any sense. So I would, advise people who are listening to heed that very carefully, because it doesn't, A doesn't lead to B, doesn't lead to C in this. There's there's got to be a huge leap before you go from this may affect melanin to this affects my outcome. As for the first question about concerns around fertility, which I've heard as well, as to date, I haven't seen any data that suggests that the vaccine may reduce fertility. Now, again, I like to bring things down to first principles. So here we're dealing with inflammation. And we know that diseases that cause inflammation, such as mumps, can affect fertility. Some other diseases that affect mucous systems, for example, cystic fibrosis, can affect fertility. Okay, so if we look at it from that sense, then we know that COVID causes a tremendous amount of inflammation. Therefore, if we're looking at it from first principles, we know that COVID causes more inflammation than the vaccine does. And if we're looking at specifically at inflammation, then we can probably conjecture that there's a higher chance of getting infertility than there is with getting the vaccine. Now, again, I'm working things out as a scientist, and it's how a lot of my scientific colleagues will be working. And in the absence of evidence, I can only go by my scientific knowledge. Now, if evidence emerges that says something to the contrary, absolutely, I'll have to accept that. But to date, I haven't seen any evidence that suggests an increased risk of infertility in people who take the vaccine versus those who don't.
Okay.
It's
still early days, though, isn't it?
It's early days, but millions of people around the world have had the vaccine. So I think what I find is that there are many people in all communities who are cherry picking data. We have more and more data. People can look at the millions of people that have been vaccinated and look at the data in that, rather than looking at the 100 people that they've chosen to select and from which to arrive at conclusions.
I should also add that that you do not require an NHS number or GP registration, and there are no immigration checks needed when it comes to the virus. So thank you for that, Belle.
That's an important point, actually, Rudy, that I've been thinking about for a few days, because there are going to be people who are here who have been trapped in the UK during lockdown, who are absolutely terrified, and they fall within the age groups. And I certainly feel for those people, and I'm really glad that you've mentioned that again, because if they know that they can go and have the vaccine as well, and it won't compromise their stay here during this frightening time, then they may be more willing to go.
Yeah, I think it would be helpful if you could talk a bit more about the transmission of the virus, because I think that is still a challenge for a lot of people to actually understand it from an airborne perspective.
Really, before I answer the question, I see that somebody has their hand up.
Right? Have they?
Maurice.
Maurice, okay. All right, yes. Maurice Ellington.
Hi, good afternoon. Thank you very much, Doctor. Thank you very much, Rudy, for providing this forum. You've answered quite a few of my questions, but one of the questions that I hear repeatedly is about the variants that we are seeing, not just in developing world, but also in non-developing parts of the world. One of the concerns I hear is that, A, does the current vaccines cover the multiple variants that are out there? And if they do not, are we looking at multiple vaccinations, multiple vaccines? Or are we going to be looking at one overarching vaccine which will cover all the different variants which seem to be popping up every now and again?
Yeah, thank you for that, Maurice. So Dr. Fauci actually addressed this very question in Congress. And what's become very clear is that immunity, when you have immunity to one variant of the virus, there is crossover immunity as well. But that crossover, just because you have, for example, 70% immunity to one variant, it won't translate into 70% immunity. There is slight crossover, but it may be markedly reduced in the new variants. So to answer the second part of your question, will there be kind of boosters, top up? Well, the government's already speaking about boosters for one variant. I don't know which variant, but for a particular variant in certain age groups. So boosters absolutely will be required. Now, what's difficult to know is how long each vaccine lasts and how frequently these boosters will be required. But the fact that we have enough data to know that actually boosters will be required for certain variants, and the fact that they've now developed, they're now confident that the vaccine will respond to these new variants is very, very, very positive news. Does that answer your question?
It does, yes, because it does look like we are looking at a situation where boosters or top-ups, for want of a better word, are going to be required, because we're going to see mutations of COVID going forward. And it's just a case of, well, how is the medical profession going to deal with these variants as and when they do come up?
Yeah, I mean, medical professionals and scientists are trying very hard. And also, do you know what, Maurice, the general public has a part to play as well, because these variants can still strike you hard, even if, one variant can still strike you hard, even if you've got immunity to another. It's important for people to carry on wearing masks and social distancing, because you can still get KO'd by that next variant.
Yeah. Thank you very much. Yeah, you pretty much answered my question. Thank you.
Thank you for your time.
Thanks for that, Maurice. So, Dr. John, I was really alluding to airborne transmission, whether you could talk a bit more about that, and obviously, and the challenges around the respiratory droplets as well.
Absolutely. Really, can I clarify, when you say people are concerned, people who've asked you are concerned about the mode of transmission, do you mean droplet versus airborne, or just how it's transmitted?
Again, it's just generally in terms of the transmission of the virus, within families, at work, local communities. There's still challenges around, comprehending that danger.
Yeah, so last March, when we first identified this virus, the understanding globally back then was that it was spread by droplets. So obviously the idea was that if you're 2 meters away from somebody, that won't give sufficient time for the droplets to be spread, unless of course you sneeze or you cough. Data emerged from different countries showing that actually it's airborne and it can stay in the air for several hours. And various countries did experiments, and the results were repeated that showed that actually it is airborne. It can be transmitted, through if one person holds a spoon, another person carries the same spoon. So they did an experiment in various restaurants with dyes, and showed that actually it's transmitted within a few hours. If one person had it within a few hours, a large proportion of people in the restaurant have it. So now it's very clear that it's airborne. It's very clear that it can stay inside a room, inside a closed space for several hours, and it can also be transmitted through inanimate objects. So this shows that actually the measures that we've had so far, social distancing, does provide some degree of protection. Wearing masks absolutely provides a great degree of protection, and obviously hand washers, they provided, in between, using phones, using cutlery in a restaurant and so forth, they provided an impressive degree of protection. So the measures that were actually put into place at the start of the pandemic, I think what the scientists said, or must have been thinking, was, what if it is airborne? What if it's transmitted this way? What precautions can we take? So they took preemptive measures that have shown to work. So for people to be safe at home and in their communities, wash your hands regularly, use the alcohol wipes, wear a face covering, and maintain your distance. These are simple things, but these work.
Okay, thanks for that. Right, so we've had a message from Ricardo Johnson, and he says, you've mentioned there are a number of vaccines that are being developed, and there are also a number of strategies that don't include vaccinations. Are there any of these non-vaccine methods that involve exercise, physical activity, or breathing capacity activities? So I guess it's an alternative to the vaccine is exercises, physical exercises.
I've heard about this. People say if you take deep breathing, you expand your lung capacity. And again, I think, first of all, thank you for the question. And I've heard these things, being promulgated, even within my own profession. But it's important to obviously think about the basis upon which these ideas are built. So we know that exercise, for example, does boost your immunity. We know that exercise does keep you healthier. But exercise itself has its own limits. The virus has ravaged athletes. It's ravaged people who don't smoke. Okay, and the virus affects the immune system primarily. So again, this is what I'm trying to encourage people to think critically about these things. So does exercise in any way impact the immune system enough to affect the virus? Well, the data doesn't show that. Do lung capacity, exercise designed to increase lung capacity, do they affect the virus and the virus enough to prevent immunity? Well, actually, in severe cases, the virus causes fibrosis of the lung, which means that the tissue in the lung becomes thickened. And no amount of exercise is going to prevent that thickening because it's very aggressive. So in answer, to answer the question, I would say those measures can serve as an adjunct, I suppose. You can use them alongside having the vaccine or other interventions, but if someone's intending to use them as a curative or solely as a curative or preventive measure, I would say that's quite unwise in light of current evidence.
Okay, thank you for that. Right. So are there any other points?
Yeah,
Yes, you.
in the early period of the virus coming into the UK, there was this report that it was impacting more on the Black community than any other communities. And it would go up in grades as to it impacted more on the African community than it does on, say, the Asian community and coming down the line. And so I wondered if the doctor is able to give any indicator as to what could be causing that. In the beginning, there was this point around what it could be. And one of the ones that I can remember is people saying, well, it's probably linked to the fact that because we're Black people, our immune system is weaker because we don't get enough vitamin D in the UK based on the fact that it's a cold climate. Is that scientifically true? And is there a way that we can boost the immune system in the lack of sunlight? Do we need to have more vitamin D, for example?
That's a very good question. That's a very good question. You've touched on a very important point related to vitamin D. It does seem a bit unfair that the virus disproportionately affected Black communities, even before we knew about the measures to be put in place. What we do know is that certain variables or certain factors contribute to a higher harm and death from COVID. Those variables include diabetes, include things such as high blood pressure, include obesity, okay? And unfortunately, those things are found in higher rates in Black communities. Now, is it because of a genetic predisposition? Possibly. But these things, high blood pressure, obesity, type 2 diabetes, are found in communities that are generally, and this is not just Black communities, they're found in all communities that generally happen to be poorer, happen to be under a lot of pressure, happen to be in very stressful occupations. We know that the Black communities normally fall under this umbrella. They normally do have a lot more stress, do have higher rates of mental health problems. They do live in poorer areas, for example. And that's because that's a result of several historical factors, which I won't go into right now. As for the topic of vitamin D, you mentioned about the immune system being weaker. I wouldn't say so much the immune system being weaker. I would put it, you're definitely right on point. You're definitely thinking along the right lines. And the way I would put it is that actually melanin, okay, is meant to reduce the amount of the sun's rays that enter our skin to protect us from getting mutations. That also means that we get less vitamin D, unfortunately. So we're living not so much in a cold country, but in a country that has less sunlight. We know that vitamin D does have a great degree of involvement in the immune system, okay? And it helps the immune system. And the data on vitamin D isn't conclusive. The first set of data said actually vitamin D is an absolute magic pill. It does help to boost the immune system. Other studies have shown different things. As one of my doctor colleagues put it, he said, you know what? Taking the right amount of vitamin D won't harm you. And if there's a small chance that it could boost your immune system enough to provide some protection, there's no harm in taking it. So I would say there is contradicting evidence for the use of vitamin D, but the fact that some evidence supports it means that I wouldn't attack anyone who uses it.
Okay. Thank you.
Does that answer your question, Hugh?
Yes, it does indeed. And thank you so much, not just for that particular question, but for all the other answers and clarifications that you've given. I think it really has been very productive and useful going forward. And the fact that Rudy will be putting this onto Facebook, it means that those who are not able to be with us tonight can see it tomorrow, later today, next week, or whenever, and get the information that they're seeking.
No, you're very welcome.
Thanks for that. Dr. John, there's a follow-up on the last question, vaccines and other methods. So just for reiteration, are there any known non-vaccine methods that are being developed?
Yeah, sorry, Rudy. Yeah, Ricardo, thank you for the question. Very good point. I'm glad you followed up with that question, actually. So I'm working on a study at the moment that involves, so let me start actually from the top. So we know that when the virus first emerged, some people developed immunity, they developed antibodies right away. And we were able to get these antibodies in their plasma, okay? And some of the labs, in various labs around the world, were able to find out the exact antibodies and re-engineer them so that they could last around 6 to 9 months. Now, some of the trials that are happening at the moment are gonna directly inject the antibody into people's bodies. So give them almost immediate protection. Okay, Donald Trump, for example, he had got COVID himself, and they injected a whole host of these these antibodies directly into your immune system. Now, what's the advantage of that? Some people's immune systems are so impaired that trying to give their immune system a boost to create soldiers doesn't work. People who are undergoing chemotherapy, radiotherapy, people who have HIV, people who have certain forms of cancer or leukemia, vaccines will not produce an immune response for a lot of them. So this antibody solution is just fantastic, and that's one of there are going to be several of them, because as we have these variants, they're probably going to be antibodies to the variants.
Okay, thanks for that, and thanks for that, Ricardo. Two really strong points. Right,
Ricardo, has that answered your question? Sorry. It's gone on mute. Okay.
Right, that's okay.
Right.
Hello?
Wait. Oh, hello. Hello.
Hi. Yeah, thanks for sorry, my background's a little bit funny. That's why I've taken the camera off.
Okay. It's
That's
okay.
okay.
Because I'm not trying to be elusive.
What? You're not trying to be elusive like COVID?
No, exactly. I'm not at all. Not at all. Yeah, thanks for the main thing that I just wanted to that's why when I asked the first question, it was off the basis of these other strategies that are potentially being developed, and I wanted to know a little bit more about what they consist of and what they were all about. And the question I wanted to ask wasn't that does exercise stop COVID? My question really was, with these new strategies that are being developed, is there any that are based on or have exercise as one of the components of these non-vaccinated methods that are being looked upon or being developed? And
I mean, there's one that's it's not so much exercise based, but it's based on the mechanics of your human body, right? And it's called proning. And proning involves moving the body in such a way that the pockets of air in the lung are used to their maximum capacity. But that requires a very specific turning and very specific monitoring. So you turn the patient to a certain side and you monitor their oxygen level, and that has actually helped. Now, whether you can do that at home is another question. It is another question altogether. As to whether exercises that people have been prescribing, breathing, taking 10 breaths, there's no evidence for that as far as I know. Once that data emerges from reputable sources, then I'll be happy to obviously change my mind.
Right, thanks for that. Right, we've come to the end of this session. Thank you very much. And I'd just like to thank you all for attending and really leave the last word to Val. We must thank the Women's Committee from ACLC up there in North London in Haringey. It's very well done. Over to you, Val. Did you just unmute?
Oh, yes. Can you hear me?
Yeah, we can hear you.
Brilliant. First of all, I just want to thank you so much, Dr. Ndikum. Is that right?
Dr. John.
Dr. Ndikum or Dr. John?
Dr. John.
Dr. John.
That's what my patients call me, so
I
that's
just
fine.
want to thank you so much for taking your time out to come to educate us around the confidence in having the vaccine, and your scientific and elaborate answers. I hope it has satisfied whoever has tapped in to listen. I've taken the vaccine and I was hesitant at first, had some questions answered, and I felt, my mom is taking it. If I'm allowing my mom to take it, why am I not taking it? So I've taken it, and so far, in Jesus' name, we're good. And I just want to thank you on behalf of the ACLC West Indian Cultural Centre and thank you, Rudy, for putting this on so that we can educate and inform our community to make the right decision, because we want to keep everyone safe and we want to make sure this COVID go away forever. And we thank you for your expert. Thank you all the members who've come in, all the participants, and those who are watching on Facebook, we thank you as well. So thank you on behalf of the ACLC Women's group and ACLC itself, because it's a vibrant center for the Black community, and we're here to empower and inform and provide leadership. And we thank you, Mr. Francis. Thank you for being here and participating as the WICC representative.
Right.
So thank you, all the participants. Thank you, Rudy.
Thank you. And good night. We'll be back all throughout April. So there's going to be lots of opportunities to hear, ask questions on all platforms, our community radio stations, our networks, our Facebook, everything. We're fully engaged in this, and we will ensure that everybody gets the information that they need, because it's important to be informed, reassured, so that our communities can make the right choice. And that includes our workforce as well as our communities, because our workforce is our community and our community is the workforce. And we want to keep everybody safe and we want to make our contribution. So thank you very much, everybody, and good night.
Thank you, everybody. Have a great night.
Thank you.